Hello and welcome everyone. Thank you for joining today's presentation from the Health Connector, where we will present an overview of the Health Connector and resources available for those in need of health insurance coverage. Today's presentation is Need Health Insurance? New savings are here through the Health Connector. We have a number of participants who have signed up, but we will get started at 10 a.m. today as scheduled. I'm Shaitra Sanders from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues Nikki Conti and Melissa Montron, who will be presenting today's information, and we are here to help answer any questions you might have. I would like to take a moment to thank elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion will last approximately about 30 minutes. Then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A functionality on your toolbar. We will be monitoring your questions throughout. Please do not disclose any personal information or protected health information when you ask your question, as others on the call may be able to see what you've written. If you have a specific personal scenario that you want to discuss with someone in more detail, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local navigator or assister. We are recording today's webinar. Following today's meeting, you'll receive an email with the presentation along with a brief survey about the information we've shared, so there's no need to take detailed notes. Please complete the survey if possible, as we'd appreciate your feedback on today's session, and your input will help us develop future presentations. So without further ado, let's go ahead and get started. I'd like to introduce Nikki Conti.
Thanks, Shaitra, and good morning, everyone. Thank you for joining our presentation today. So we're going to go over a number of items, and they're organized here. I'll be providing an overview of the Massachusetts Health Connector and also some details about the American Rescue Plan. We'll talk about getting coverage through our organization, through the Health Connector. We'll spend some time talking about how you can get some help with this process. I'll go over reminders and also share some helpful ongoing resources. So let's start with an overview of the Health Connector. So if you go on to the next slide, some of you may or may not be familiar with what the Health Connector is. So if you're not familiar, we just want you to be aware that we are the state's health insurance marketplace. And we're here to provide individuals, families, small businesses who don't have access to health insurance, that access to affordable health insurance coverage with an easy way to compare options. So typically people who are members are those who don't get health insurance through their jobs, their spouses, their partners. Also, a lot of people who apply for help getting coverage also qualify for help paying for their monthly premiums. And you'll hear me talk a lot about health insurance plans as I go through today's presentation, but I also want you to just be aware that we do offer dental coverage as well. So going on to the next slide, this slide here is just basically giving you an overview of the Health Connector plans, the structure of them all. And I want to start off by just acknowledging that all of the plans sold through the Health Connector meet both state and federal standards for coverage. So you may be thinking, okay, why is this important? One, you can rest assured that you are getting comprehensive benefits. You are getting coverage that meets state requirements. Therefore, in Massachusetts, you would not be penalized by when you buy or shop and enroll in a plan through us at tax time. When you acknowledge that you have health insurance coverage through the Health Connector, you would not be penalized. The health coverage from the Health Connector meets state standards. So A little bit of health connector, health insurance speak. So all of the plans sold through our organizations are known as qualified health and qualified dental plans. So depending on where you live in Massachusetts, you're going to be able to choose from plans that are available in your area. We have a number of the leading insurance companies in Massachusetts who partner with us. Now, unique to the Health Connector, because we're the state's marketplace, you can get health plans with premium tax credits. So basically, people with incomes in a certain range qualify for tax credits to reduce their cost of monthly premiums. Also unique to Massachusetts is these connector care program or these connector care plans. So people who are in lower income ranges who meet other eligibility requirements can qualify for low or no cost health insurance coverage. And actually part of today's presentation, we'll be talking about the ability for people who have been on unemployment income at any point this year, how they can in fact qualify to enroll in connector care plans if they need coverage. In the bottom left-hand corner, you'll notice catastrophic plans. We do have those available, and those are available to people who are under 30 years of age or with a hardship exemption. And typically, or generally, those plans are lower. There's a lower monthly premium, but there is a higher cost at time of service. So the deductibles are higher. And if you are getting prescriptions or having any type of procedure, the costs are higher there. Now, at the bottom here, you'll also notice a little description about dental plans, that we have them available for individuals, children, families, small employers, and we also sell pediatric only plans or plans with lower and higher deductibles. So going on to the next slide, I want to just orient you to the American Rescue Plan and talk a little bit about that. So this was a law that was signed in March of this year, and part of it makes financial help with health insurance more available to many more people. So a lot of people who already were getting help paying for health insurance through the Health Connector now are even getting more assistance. And people who did not qualify for help before can now see lower monthly premiums. So it's really worth, if you're in need of health insurance coverage, it's really worth investigating whether or not, what your savings could be now that the American Rescue Plan is here and it's in place. So going on to the next slide. I'll just talk more specifically about the benefits of the American Rescue Plan and how this could be relevant to you. So I've mentioned that there's more help paying for monthly premiums available if you shop through the Health Connector for your health insurance coverage. And one of the things the American Rescue Plan did is it changed the way we look at someone's income. So people whose income might have been too high to qualify for help in the past may now be eligible. So basically, instead of an income limit for financial help, help is going to be based on affordability. So tax credits that lower the monthly cost of plans are available for people at any income level if the plans cost more than 8.5% of their income. Now, really important here, people who qualify can only get these savings on their health insurance plans if they enroll through the Health Connector. And we have a new tool on our website that lets you preview the plan costs that you might qualify for. So basically, when we get further into our presentation, my colleague Melissa is going to step you through this Get an Estimate tool and show you how you just enter some brief information about yourself and you can see the saving, you'll see the plans that are available to you as well as the savings. Now, also really good news for folks who received unemployment income at any point this year, you now have access to low or no cost connector care health plans, even if you wouldn't have qualified before based on household income. So going on to the next slide, I want to quickly jump ahead in time. So when you're going through our online application, you're going to get to a page in the application that asks you about having unemployment income in 2021. So I just want to point that out because that is really new. So if you haven't completed an application yet, or if you've completed an application and you want to go back in and update this, we really encourage you to do that. Because then you would be screened to see whether or not you could qualify for the low or no cost connector care plans. So going on to the next slide, I also want to point out that there's new help paying for Cobra. So one of the things the American Rescue Plan did related to Cobra payments is American Rescue Plan made Cobra payments $0. So those $0 plans, or if somebody was enrolled in Cobra, basically they would be subsidized completely the cost of the monthly premiums. And that was from April through September of this year. So as you can, we're in the middle of August. So, I don't know where the participants on this webinar might be on their health insurance journey, but if you're thinking about applying, if you're kind of trying to weigh your options between Cobra or the Health Connector, you really need to just think about your own situation, yourself or your family's health needs, and whether or not you want to stay in your current plan enroll in Cobra, or come to the Health Connector. So for some, it's a better deal to come to the Health Connector because you could potentially also see savings for your co-pays for when you're at time of service, etc. But if someone does choose or decided to go the Cobra path, I just want to acknowledge when those federal subsidies end in September, people who chose to take Cobra still have the option to enroll through the Health Connector. So losing help paying for Cobra is going to be a qualifying event this year that lets somebody enroll outside of our regular open enrollment period. So on this slide here, I won't spend too much time here, but rather just say people are going to see a variety of savings with the American Rescue Plan, and it's based on their age and based on where they live in Massachusetts. So for example, if someone is 50 years old in Worcester and their income is at around $44,000, they are eligible for advanced premium tax credits. So prior to the American Rescue Plan, they were paying about $371 for a monthly premium. Now with the American Rescue Plan, they have a monthly premium of $269.82. So that is over $100 of savings. So we're really happy about this. And again, you'll notice in these examples, there are different ages, different income ranges, different savings available to them. So typically people who are on the older end of the spectrum are going to see more savings as the cost of health insurance tends to go up as we get older. Going on to the next slide. This is actually where I'm going to pause and hand the baton over to my colleague, Melissa, who's going to take you through some more of the details about applying for coverage, and I'll be back in a few slides as well. Thank you.
Thank you, Nikki, and good morning. So basically, I'm going to go over who can apply. So applying through the Health Connector, you can apply if you live in Massachusetts, are a U.S. citizen, U.S. national, or are otherwise lawfully present in the U.S. and don't have health insurance. You should not apply if you are enrolled in Medicare, Mass Health, which is Medicaid, or other public health coverage, are offered affordable comprehensive health insurance from an employer, or you are in jail. So who can enroll? So special enrollment periods, anyone can continue to apply for health benefits anytime during the year, but special rules are in place for enrollment in Health Connector coverage during closed enrollment. The Health Connector's extended open enrollment period ended on July 23rd. Certain situations may qualify individuals for a special enrollment period, which is the SEP, which gives them up to 60 days to enroll in a Health Connector health plan. Loss of other health coverage, such as loss of job-based insurance, Cobra coverage ending, or loss of mass health coverage are examples of why someone may qualify. In addition, the Health Connector will have a special enrollment period available in the fall for those enrolled in Cobra, but are no longer eligible for federal subsidies. If you need coverage sooner, apply right away. You may find you qualify for Mass Health. So applying for coverage. Here's what you need to know. There are 3 ways to apply. The first way is online at mahealthconnector.org. And we also have a Spanish version, which is the mahealthconnector.org/ES. The second way is by phone. And the third way is with the help of a partner community organization or health center. There is one application to find out if you qualify for coverage through Health Connector, including help paying for coverage or for coverage through Mass Health. You will get letters from Health Connector and Mass Health that tell you your next steps. And what do you need to apply? You will need Social Security numbers for everyone applying if they have one, immigration documents for all non-US citizens who are applying if they have one. And you can also learn about these documents in the immigration documents section. Recent pay information if you have it, such as copies of your last pay stubs, your unemployment amount, monetary determination if you are collecting unemployment, information about your current income. If you don't have all the information above, give us what you have and we'll send you a letter asking for more information if we need it. Application for individuals and families. So what you need to do to apply is go to the mahealthconnector.org. And if you would like the Spanish version, you can go to mahealthconnector.org/ES. One application for the Health Connector, Help Paying, and Mass Health. So basically this screen right here is our home page. And when you go onto the home page, circled in red is where you sign in. And if you don't have an account, circle in red is create an account. How do you enter income if you're unemployed? When you complete an application, you'll be asked about your current income and your estimated income for the year. So what you want to do is enter your current income as it is right now, including unemployment income. Then enter your expected yearly income based on what you think you'll make over the course of the year. When entering your yearly income, consider how much you earned so far this year. Add any unemployment, including any extra dollars per week you may be receiving. If you think you will be returning to work later this year, include what you might have earned. If your income changes later, update your income information so it is as correct as possible. So keep your income and application up to date. Remember to update your income if your employment situation changes. Keeping your income information as accurate as possible helps you make sure you get the right amount of help paying for health and dental insurance, have a lower risk of owing money to the IRS when you file taxes next year. If you get advanced premium tax credit, which is the APTC, you can always adjust the amount you take by clicking on the Change tax credit link from the Find a Health Plan page of your application. If you adjust the slider tool to take less APTC, your monthly premium would be higher, but you might owe less to the IRS when you file your taxes. So this completes my section, and I'm going to hand it off right back to Nikki.
Thanks, Melissa. So folks, I'm going to talk a little bit more about getting help paying. So going on to the next slide, you keep hearing us talking about these advanced premium tax credits. So these may be new things that you are hearing or new terms that you're hearing about. So essentially, we just wanted to explain that there are two kinds of help paying. There are two kinds of help available for paying for coverage that you get through the Health Connector. So there are advanced premium tax credits, and then there's this Connector Care program. So advanced premium tax credits basically lower the premium amount you pay each month. The IRS is going to send the tax credit that you're eligible for directly to your insurance company. So you as the consumer pay less each month. Melissa was describing that you can choose to take all of that tax credit that you're eligible for, or some of it to apply to your monthly premium payment. So sometimes people will choose to take less of that tax credit, basically to protect themselves at tax time. So if their income kind of goes up and down a bit, they just take a little bit less. But depending on your circumstances right now, you might say, nope, please apply everything that I am eligible for to my monthly premium. So I'm paying as low as I possibly can. Now, this Connected Care program that we run uses federal advanced premium tax credits as well as state funds, and those two together help reduce the premium amount you pay each month. The way we've designed the Connector Care program is to have low monthly premiums, low out-of-pocket costs, no deductibles. So these are comprehensive health insurance plans. And depending on the plan type you qualify for, you can choose a plan for as low as $0 a month up to the lowest cost plan in that particular plan type, which is $133 per month. And we have some slides that you can use as reference at the end of the presentation, as well as places on our website that we can provide links to, where you can see what the costs are, what the lowest cost Connector Care plan is, as well as the copays for each of the different benefits. So on the next slide, we want to spend a little time talking about income guidelines, which to qualify for help paying for coverage. So what you're seeing here is a income chart. On the left-hand side, you have the household size, the qualification levels for the Connector Care program, as well as qualifications for advanced premium tax credits, that federal help. Now, as a reminder, the American Rescue Plan removes the income limits for advanced premium tax credit help. So as of May of this year, people with income that was more than 400% of federal poverty level also qualified for advanced premium tax credit, because instead of an income limit, people are going to qualify for advanced premium tax credit based on affordability. So it's a little bit more complex, but the system, our online application, will figure this out. And basically, advanced premium tax credits become available to people to lower the monthly cost of health plans, so they're not paying more than 8.5% of their income. So going on to the next slide, I think I'm going to just talk a little bit about choosing a plan and enrolling. Let's see what's going on here. Yes. All right. So we've covered quite a bit here. We've talked about the American Rescue Plan. We've talked about requirements for getting subsidies, getting help, what all of that is. And you might be wondering, okay, well, I haven't even gotten to the point of shopping for a plan. So once you know what you qualify for, the next step in this process is going to be to shop for a plan. So we have online tools where you can enter provider preferences, medication preferences, and before applying, you can actually use our comparison tool. And so this will let you compare the plans that are on our site based on your provider, your medication preferences. And then also, if you're looking for pricing, you can use the preview plans button from the application homepage. So as you can see on this page, when you get this presentation, you can click on all of these links and you can use these tools. And also remember, Melissa's going to give you a demo of the Get an Estimate tool. So people, if you're using these two tools, you won't see the connector care savings, but from the Get an Estimate tool, you do see the connector care savings, which is great. So going on to the next slide, I wanted to show you that when you're in the application, you do have the ability to enter your preferred providers and facilities, as well as preferred prescription drugs. In the next slide, you'll see that when you are looking at your health plan results, any providers that you would put in, so on the left-hand side, you're seeing a circle that shows you the doctors that I had put in, a facility that I had put in as a preference. And then on the right-hand side, you're seeing the circle that says, you know, 1 of 10 of 48, 1 to 10 of 48, excuse me. That basically means that there are 48 plan options. And at the beginning here, we'll only show you 10, and you can click to see more as you go. And what you're, as you go through, you will see, you will tend to see the best match first. So you'll see the plans first that have your preferences, and then it'll indicate whether or not any of your preferences are available. So we really encourage you to use these tools. Now on this page, I just want to acknowledge that when you get to the point of, making your final enrollment choice, you will also have the ability to make a payment if you owe a payment. You can make a payment online here as well. So on to the next slide. I'm going to pass this back to Melissa because I know we've covered a lot of information, and people are in different, people have come to us from different circumstances. So some people I know are going to dive right in, start applying on their own, but others might want some help either right away or as they're going through the process. So Melissa, can you talk a little bit about customer service and some of our community partners?
Sure, Nikki, thank you. So I'm going to go over the getting help. So where can you get help enrolling in health insurance coverage? So free enrollment assistance is available through the Health Connector customer service and across Massachusetts through community partner organizations. So the customer service number is 877-MA-ENROLL, which is 877-623-6765. Or our TTY number is 877-623-7773 for people who are deaf, hard of hearing, or speech disabled. For information about hours, days of operation, and more, you can go to the Health Connector Customer Service Call Center. So our community partners are trained and certified navigators and certified application counselors who speak many languages, can help you from application through enrollment into health insurance plans. They can answer questions about eligibility, the application, payments, plan details, and healthcare reform rules and requirements. It is recommended that you call ahead to schedule an appointment for help. And to find help in your language, you can go to the Get Free Help Near You link. So now I'm going to pass this right back to Nikki for some reminders and details.
Thank you, Melissa. I was just having a technical blip here. So let's go into look at some of the key takeaways. All right, great. So, all right. We want you to, again, one of the main reasons we encourage you to join today is to just acknowledge that people, that we have these new savings available through the American Rescue Plan if you come to get your health insurance coverage through the Health Connector. So please keep in mind that people whose income may have been too high in the past to qualify could now be eligible for Health Connector plans with savings each month. So remember, more help available paying for monthly premium costs through the Health Connector for anyone who got unemployment income in 2021. Now, we don't know what your circumstances, so keep in mind if you lose or you know someone who's losing employer coverage, know that that's considered a qualifying life event. So that situation in and of itself is going to give somebody a special enrollment period to get into coverage through the Health Connector. If somebody is in that situation, they need to apply, compare options, and enroll in coverage within 60 days of losing the employer coverage. Now, as Melissa said, you can apply for coverage online, by over the phone, or with help from an assister. And please keep in mind that as you're going through this application process, some people will get this automatic special enrollment period and they can shop and enroll right away. On the next slide, if somebody gets stuck for any reason, we really just encourage you to call Health Connector customer service for help. They can either help identify why you've been stopped or help to push you through so that you can get into your coverage. Now, key dates here, really, really important. So we have deadlines each month so that people can apply, enroll, and get into their coverage. So our deadline for all of those activities is the 23rd of the month before coverage can start on the first day of the following month. So for example, if somebody's looking for coverage September 1, you need to take steps, enroll, and pay for that coverage by August 23rd so that you can effectuate into your plan September 1. Technically speaking, we do like to let people know this just in case. If you like to be ahead of the game and you're applying, you can also choose to have your coverage start on the second month. So I just want you to know that you have that option if you're shopping in advance of when you need the coverage. Now, as Melissa said, you can get free help applying and choosing a plan through the Health Connector's customer service across Massachusetts through community partner organizations. And particularly right now, as we're still in the midst of this public health emergency, we really, really suggest you call to make an appointment for help. Many of our assisters, many of our community partners are seeing people, a lot of them are seeing them in person again, but many are able to see you or talk with you remotely and get you the help you need without having to leave your home. So really just encourage you to call to make that appointment for help. So this is typically where we go on to questions as part of our presentation, but instead we're going to ask Melissa, before we dive into questions, Melissa, could you launch the demo for us?
Sure, Nikki, thank you so much. So I'm just going to share my screen if you can give me 1 second. Okay, I hope everyone can see that. Okay, so now what I'm going to do is go over a demonstration on how you can get an estimate on our website, which is it's the www.mahealthconnector.org. And right here on our page, if you go all the way to the top, get an estimate, you want to click on that, you want to hover on that, and then go to individuals and families. Okay. And then on this page here, if you just click down, it's basically asking about your household and to check to see if you qualify for savings. So what I'm going to do is just give an example of a married couple. So we choose your coverage year, which is 2021, and I'm going to enter a zip code. And then you enter what you think your household income will be for the year. So I'm just going to say $60,000. And then the number of people in household, including people who may not need coverage. So I'm just going to say a couple of two, a married couple. And then you want to enter here the age of head of household. I'll say 32. Age of person two, I'll say 28. And I'll say that here on the side, it's going to ask you if this person needs coverage. I'll click on yes for both of these. And then they also have a couple more questions here. If the person is pregnant or the person is disabled or blind, which those questions are there because it would mean that you basically would qualify for Mass Health. So then I go here to my results. And then this is basically saying that this isn't an application for health coverage. It's just giving you an estimated what you would qualify for. Okay, so here on this page is the estimated eligibility. So based on what you told us, your household may qualify for an advanced premium tax credit to help lower your monthly health insurance premium costs. So your maximum tax credit amount is $293. You are eligible for silver plans with monthly premium as low as $341.53. So, and then it basically breaks this down. So household member 1 and 2, and then the potential eligibility for each one. So this is great because it basically tells you how much you're saving and how much your premium cost would be. And then we have a further option here in which we can preview the plans and basically see exactly how much you'll be saving per month. So here we have qualified health plan options. So we have the carrier, the plan name, the coverage level, your monthly premium, and the savings, your APTC savings, and what you would pay monthly. So this is basically a breakdown of each one. So you can basically see here your savings and how much you would pay monthly. So it just gives you more detail before you actually go into the application of exactly what you can expect when you are applying. So and then that's basically it. And then you have the option here if you are wanting to apply, you can apply here and just click over this apply now button. But this is great. It's just basically breaking everything down for you and giving you some details. So it's definitely a great tool to see where you would qualify and what you would be responsible for. Okay, so I am going to hand this back over to Nikki.
Actually, Melissa, don't go anywhere. We're going to need you for questions too.
I was about to say, Melissa, hold on. I really need you right now. So
I'm still here.
Don't go anywhere. Well, ladies, thank you so much. I think that was a great presentation. I really love the demo at the end. That's something I don't regularly utilize. So now I know how to utilize it. So again, thank you so much. And I think this was very, informative. During the presentation, some of our attendees have asked a few questions. So I'm hoping that I can ask those to you ladies right now. Let's actually go to a question that was brought up at the very end because it does have to do with the demo. So Melissa, when you were doing that demo, I believe you put in a income of about 60,000. And so someone was curious, was that 60,000 income entered the combined income for both household members? And obviously, if that was so, what should people be reporting for their income?
Okay, yes, that's actually a great question. So yeah, I should have mentioned, yes, it actually is the combined income. So we have to include in the application the household income. Even if that particular person is not actually applying, we would enter that income for the household. So it is combined, yes.
Great. Thanks so much.
Mhm.
And ladies, there, I guess some people know some words out there. So is health safety net different than Health Connector?
Okay, that's also another great question. So, the Health Connector is a separate agency than Mass Health. However, the Health Connector and Mass Health are very closely related, as people can see. So, if you're applying for coverage through mahealthconnector.org, you can actually find out whether or not you qualify for a Health Connector plan or a Mass Health plan. And in some instances, people qualify for Health Safety Net. So the health safety net and the health connector, yes, different things. The health safety net are a set of benefits that people can qualify for, but it's not health insurance coverage. So it's what the name suggests. It's a safety net of services that people can get, but it's fairly limited, and it's not comprehensive health insurance coverage.
Great. And I guess this is either for you or Nikki, you or Melissa. When entering income into the application, or I guess even the estimator, right? Do you include the extra $300 of unemployment income?
So I'll start off, and if there's anything Melissa wants to add, certainly she's welcome to jump in. But basically, as you're going through the income screens, as Melissa said, you need to answer questions about income for yourself, other people in your household. If you're collecting unemployment income, or you've collected unemployment income over the last year or so, you would have, a number of people got additional dollars from the federal government. So she was asking about $300. So the $300, you don't need to enter the $300 when you're entering the current income. However, when you're projecting income for the whole year, that's when we need to understand the person's whole picture. So if somebody worked at the beginning of the year, then started collecting unemployment and they got that extra $300 a week, we need to know about the work at the beginning of the year, the unemployment income. We need to know about $300. I believe that's ending in September. So when that ends, you kind of need to, I know we don't have crystal balls, but you kind of need to guesstimate, use your best guesstimate to figure out, okay, what could my income look like for this whole year? So that was my very, very long way of saying, no, don't include the $300 in the current income, but yes, do include it when you're projecting your annual income.
So in the end, it is reportable income for the application.
You got it. You got it.
Right.
In the end, it is income that needs to be reported. Thank you.
Perfect, Nikki. Thank you. And now, Nikki, you actually spoke a lot on the American Rescue Plan and its benefits and some of the items that have come about because of the American Rescue Plan. And so some of our attendees want to know, when does the American Rescue Plan end? Or are there certain benefits within that end at certain different times?
Yes, actually, maybe that's the better way to frame it. There are a variety of benefits, and as it relates to the Health Connector and health insurance plans, there are different time frames. So I think it's helpful to say, for those who are on unemployment income, who are going to qualify for that benefit of being able to enroll in a $0 connector care plan, that benefit is only for calendar year 2021. So that's really, really important. If you are that person or know of a person who currently is on unemployment and needs health insurance coverage, or had unemployment had unemployment income at some point this year, but still needs health insurance coverage. Let's say the person's picked up another part-time job, etc., no longer collecting UI, but needs health insurance. We encourage people to apply. That is only for calendar year. These benefits are only for calendar year 2021. The other additional savings through the American Rescue Plan, the other increased advanced premium tax credits, we're expecting that not only through the end of this calendar year, but one more year after that. And then we'll see. And of course, we'll come back and share more information with all of you. But the additional advanced premium tax credits will continue into calendar year 2022.
And I apologize if I missed you saying this. I believe the Cobra had an end date, right?
Yes, thank you.
Cobra.
Yep, I said it during the presentation, but that's also another thing that we should be keying in on. The federal subsidies. So remember, people could choose to enroll in Cobra and get that fully subsidized. That ends in September. The end of September is the end date for that. We don't have any information on whether or not that. Our understanding is that is ending. So that is why in Massachusetts, and I'm sure in other states as well, but important for all of you to know that if you are currently on Cobra, you can then switch over. You can apply for coverage through the Health Connector, and losing those subsidies will give you the ability to apply and enroll in Health Connector plans.
Great. I think we covered a lot of the dates for the American Rescue Plan. So that's great, Nikki. And if anything else comes about, they can always find it on our website, right?
Absolutely. Maybe that's another good thing to acknowledge while we have people's attention. So if you go to mahealthconnector.org, Melissa showed you that you can navigate to the Get an Estimate tool. There are also other things that you'll find when you come to our website. There are pop-up screens in the bottom right-hand corner where you can very quickly get to some frequently asked questions about American Rescue Plan, about unemployment income, about getting coverage right now. So really just encourage people to come to our website, mahealthconnector.org. And if you have some particular question, check there first. And then if you can't get your question answered or you want some guidance, either contact our customer service or a local community partner.
Great. Let's go back to unemployment income. What if someone had unemployment income earlier in 2021, but they were unable to report it on their Health Connector application until right now? If they report it now, will they eventually get tax credits back for the earlier months that they were enrolled through the Health Connector? So does that reported income backdate?
Well, let me break it down a little bit. So if someone, let's say somebody was enrolled in, had applied for Health Connector coverage, and for whatever reason, they didn't report unemployment income, right? I would highly encourage that person to come into the application, update their application, indicate that they had unemployment income. So I showed you that screen during the presentation that said, did you have unemployment income during 2021? And the person would need to click yes. By doing that, it really kicks off a process on the back end where that consumer then gets rescreened to see whether or not they could in fact qualify for a connector care plan. So again, we don't know what everyone's situation is, but by doing that, they can get rescreened to see if they are in fact eligible for that $0 or low cost connector care plan. Now, in terms of that person who is known to us, we've got some sort of eligibility information about them. If they update their information with us, they're going to get redetermined. And one of the responsibilities of being a Health Connector member and getting tax credits is that at the end of the year, at tax time, you need to, as Health Connector members, people need to file their taxes, reconcile their taxes. So a really great thing this year is that people who qualify for these additional advanced premium tax credits may see more dollars coming back to them at tax time. So that's really important. So prior to the Shaitra, I gave you more information than you wanted, but I'm hoping that could be helpful to people because that screen we showed you today is fairly new. That became available to people at the end of July, early August. So really want people, if you had not in the past reported unemployment income, we really want you to do that. So one, you're properly screened to see if you can get into this low or no cost plan. And then two, we know your eligibility, so you can get as many advanced premium tax credits back at tax time that you're eligible for.
Great. And while we're speaking about reporting and possibly rescreening, what should one do if their income is likely to change during the year?
So same message. If something changes, please come back. Please come back to the application, update your application. If you don't feel comfortable using the application, or a lot of people do this every day, you may not, right? So you can contact, again, customer service or a community partner. At any step of this process, there are people who are authorized to get into the system, get into your application with your permission, and they can help you keep that your application up to date. So that is really, really important. If circumstances change, I think at one point I was talking about, projecting your annual income and kind of thinking ahead. Well, let's say you did kind of project your annual income, but what you thought was going to happen didn't happen, right? So that's why we want that's why it's important to know you can come back into the application. You can update it yourself or call for help to update it. Melissa mentioned during the presentation, by keeping your application up to date, it's basically protecting you at tax time. Melissa, I don't know if there's anything else you'd want to add here for folks, because I know you help support a lot of people who maybe in the past didn't qualify for advanced premium tax credits, but now with the American Rescue Plan, they newly do. So I don't know if there's anything new or different you want to add.
No, Nikki, nothing that I wanted to add. Again, I just think it's really important just to make sure to update your application. And again, if you don't feel comfortable, we do have a lot of people that can, assisters that can help you, guide you through the whole entire process. Again, because you just want to make sure the information is as accurate as possible, just because during tax time, we don't want you to have any issues or anything like that. So if you don't feel like doing it on your own, it's too much, we do have a lot of resources and people that can help you with that process. So that's the key thing I want to make sure everyone is aware of.
Thank you.
Mm-hmm.
And ladies, we're getting a little close to the ending. We have a little bit more than 5 minutes. So we had a couple of employer-sponsored coverage questions. So I'm hoping I could actually try to combine these all in one question and see where it goes as far as the answers. So if an individual is offered coverage through their job, but they don't think it's affordable, can they get health coverage through the Health Connector with subsidies? In addition, so maybe let's see if we can get all of these in one shot. In addition, if that employer is providing insurance whose premium is actually more than the 8.5% of the income that would apply for as the advanced premium tax credits, would they be able to get those? Does the employer's offer meet the minimum requirements? And also, if the employer's coverage doesn't meet these minimum requirements, when can one apply for the health insurance through the Health Connector? So there's a few questions in there. It seems to be very focused on the employer-sponsored coverage, if it's affordable, if the person might be eligible for a advanced premium tax credit, and does the employer's coverage hit the minimum requirements? And I see Kayla came on to help also with this question, which is great.
Great, thank you. All right, so Kayla, I'm gonna start, and then please pipe in, because I want because I'm definitely going to respond to this from my perspective, which simply is, so the concept of affordability is, we have affordability standards in the state, but somebody might be thinking about their own circumstances and thinking, it's not affordable to me. So what could I possibly do? You as a consumer, or you and your spouse, partner, et cetera, can come into the Health Connector, apply for coverage. As you're applying for coverage, you're going to be asked whether about the health plan, any health plan or any health insurance you have access to. If you don't think your plan is affordable, my suggestion would be to talk to your employer, get plan information from them. We need to understand the full cost of the plan, the contribution from the employer, and it's the employee only plan, not the family plan that affordability is based off of. So that's the kind of information you need so that the system can determine whether or not it's affordable based on state standards. I think that I'm looking at my notes here. I think that's about as much as I can answer. Kayla, can you answer the rest?
Sure. Yeah. No, that sounds great. I think that's the take-home message. Talk to your employer. In terms of when you might be able to apply, you might be eligible for, a special enrollment period if all of a sudden your employer coverage changes and there's a change and all of a sudden your coverage isn't affordable. Again, you'd need to talk to your employer about what that means. The 8.5% that we're talking about, with the American Rescue Plan and through the Health Connector is different. That's talking about what you could get in subsidies and APTCs through the Health Connector. Affordability in terms of what you should be able to afford through the Health Connector. That is not the same as what we consider, or the federal government considers affordable for employer coverage. That's a different calculation. And again, talk to your employer about that. So again, if all of a sudden you're stuck with a plan that all of a sudden it changes and it's not affordable, you talk to your employer about it, they say it's not, you might be able to come to us. But it's going to be highly individualized. So speak to your employer, maybe, but it's, unfortunately it's not as straightforward as these questions, but your employer will be able to help you, walk you through that.
And really quick, ladies, I believe the minimum coverage. So how would they know if their employer-sponsored coverage has all of the essential benefits for the state standards?
So the minimum value is actually, that's sort of what we're talking about. It's called affordability and minimum value. And if your coverage doesn't meet it through your employer, you can come on into the Health Connector and get APTCs or subsidies through us. However, the question about how do we determine that, it's complicated. And this is what you should go to your employer about, because so the definition, the IRS definition is, employer-sponsored plan provides a minimum value if it covers at least 60% of the total allowed cost of benefits. And then affordability is basically, a percentage that changes every year. It's indexed. It's not the same as the 8.5%. And again, it's just based on self-coverage. So those two things are complicated. There are lots of tools online where you can try to figure that out. But I would say talk to your employer, try to work with your employer to figure that out, because it is a complicated calculation. And I don't think it's something that you can sort of just figure out quickly. It's not as simple as the 8.5%. So that would be my advice.
All right, well, ladies, there are two more questions. If one of you guys can answer that before we say goodbye, because we are down to the last wire. If someone needs coverage later, maybe November, can they apply now and then go back in early October and finish up their application choosing a plan?
As I mentioned before, you can apply for coverage right now so it's August, you can apply for September or October. So in September, you could apply for October or November.
Great, so pretty much 2 months ahead.
Yep.
Great. And what kind of documents does one need to submit to prove income from their job? And if they do not have paper pay stubs, which most of us lately do not, could they submit a screenshot of maybe their bank account statement?
There are a variety of verifications that we'll take. My recommendation would be to check our website for all list of acceptable proof. That's going to give you the most accurate list, but we don't necessarily need paper pay stubs. Electronic versions of your pay stubs, a lot of like payroll apps allow you to log in and download your pay stubs, or, if you can speak to the former HR person, they can help you with that. But we have a lot of items that are quote unquote acceptable proof. So it isn't necessarily, we don't need that stuff.
Well, great. We actually have hit our 11 o'clock time, and we got through all the questions. So Nikki, I know this will be sent out through email with everything available, and also a survey that we ask that everyone take, right?
Yep, you got it. Please be on the lookout for that message and complete the survey. And again, we thank you. If you need coverage, please go to mahealthconnector.org. Thank you, everybody, for joining us today.
Thank you.
Thank you.